Okay, hello everyone. Again, this is another video in our endocrinology playlist. Today we will talk about parathyroid. It won't be a long video because it is a fairly small gland and there is no a lot of pathology on it. So let's carry on. When we talk about the anatomy of the parathyroid, it's not that far from the thyroid actually. Parathyroid is already sits on the thyroid gland pool, but it is more in the behind of the thyroid. It's in the posterior side, and that is actually important uh, in case of surgeries in patients who have a thyroid cancer, or a patient who had a thyroid adenoma. When the surgeon want to approach the thyroid gland, they may incidentally take the parathyroid with it. So that's why it's important to know where the parathyroid is located. Okay. And even sometimes you can find the thyroid in different places, like in the mediastinum, or more like around the sternum itself. Okay, but it's not that common as posterior to the thyroid. Moving on to the physiology, it is important to know the physiology of the parathyroid hormone and what is its effect on the bloodstream. Okay, so basically the effect of the parathyroid is to increase the calcium in the serum. And how can the parathyroid do this? By multiple mechanisms. It will go to the bones specifically and try to reabsorb the bone, or do the resorption of the bone, which is it will activate the osteoclast to break the bone and then replace it again, and this process will lead to a secretion of the calcium in the blood. Okay. There is also another mechanism. The liver will secrete vitamin D. Vitamin D will help the parathyroid absorb the calcium from the kidneys and also from the small intestine. Not that important if you are thinking about it. If you're thinking about it in the clinical way, just knowing this information is enough for you. If you are attending any a basic exam, physiology, etc., you should know the mechanism by details. Okay. So move on to the disorders of the parathyroid, which is they're not a lot. Usually it goes as the same algorithm as the other endocrine pathologies. So we always order it as this way. And when it comes to the when it comes to the disorders of the parathyroid, we have two types, which is hyperparathyroidism and hypoparathyroidism, as any kind of endocrine organ pathology. Okay, and it is divided to three parts when we talk about hyperparathyroidism: primary and secondary and tertiary. We know the primary means the problem, or the source of the problem is the hyperparathyroidism. Secondary means there is something else or another organ leads to this issue. And tertiary, we're gonna talk about it. That's a specific disorder, and it's actually interesting. Hypoparathyroidism have the primary also, which is because of the thyroid gland is already extracted, and in the extraction of the thyroid gland, the surgeon may by wrong takes also the parathyroid with it. So I already mentioned this at the beginning. Another causes could be because of increase in the calcium, so the negative feedback will decrease the parathyroid. So let's talk about hyperparathyroidism. As we said, there is primary and secondary and tertiary. Primary, it's about a mass in the parathyroid. In other words, it's a adenoma, which is secreting a parathyroid hormone, and this secretion is out of control, so it leads to a reabsorb of the calcium in the blood and breakdown of the bones, which will increase the calcium. Or on the other hand, could be also a hyperplasia, and hyperplasia depends if it's a hyperplasia because of another issue in the blood. Usually we count it as a primary, or if it's a hyperplasia from a kidney disorder, that is a secondary hyperparathyroidism, which is already written here. If the kidney if the patient have a problem with the kidneys, like chronic kidney disease, or we don't see it so much in acute kidney disease, it's mostly in the chronic. So the parathyroid will try to compensate for the low calcium, because the kidney will not absorb any calcium anymore because it's already dysfunctional. So the parathyroid will try to secrete the parathyroid hormone, trying to compensate. Okay. And also there's other condition, which is vitamin D deficiency. And tertiary is following the secondary. So when the parathyroid try to compensate for the kidney issue or the chronic kidney disease, what will happen after a certain period, the calcium will increase and the parathyroid will still be high, the parathyroid hormone, but normally it should be like this, that if the calcium is high, the parathyroid should decrease, but this is not the case here. The parathyroid hormone will still high. So this is called tertiary. So it's a square law from the secondary hyperparathyroidism. So this is a simple table showing the types of hyperparathyroidism: primary, secondary, tertiary. I recommend you to know this, memorize it, know how. Even try not to memorize, try to understand, because if you understand what is happening here, definitely you can answer any question, or you can deal with any case with a issues with the parathyroid. Okay, so as we said, the primary it's about a mass in the parathyroid secreting calcium, so the PTH will be high. Okay, so this is important here. PTH will be high. The calcium also will be high because of the high parathyroid hormone. Vitamin D also will increase because you want to reabsorb more calcium, so the vitamin D will increase in the body. Not always the case, sometimes it's normal, but keep in your mind that those two should be high, the parathyroid and the calcium. In secondary, as we said, that there is a chronic kidney disease, so the kidney is not absorbing calcium, so the calcium will be low, sometimes is normal, and the parathyroid will be high, trying to compensate here. Vitamin D is also low. Why? Because the kidney is not working. And what is the marker that will tell you that the kidney is not working is the phosphate. If the phosphate is high, that means that the kidney cannot excrete the phosphate, so the phosphate will accumulate in the blood. Okay, so that's I think that's super important. Knowing that uh, knowing that the phosphate is high and the calcium is low, that always give me a hint that the kidney is not working. And of course, you need to check bun and creatinine. Okay. Tertiary, as I said, it's, you can see here, it's the same picture. Phosphate is high, vitamin D is low. Still, we have chronic kidney disease, but the only difference that the calcium increased, and that's good. But the problem here that parathyroid did not sense this, and it still goes high, still is increasing the calcium, and the problem is not fixed. Okay. Move on. And hyperparathyroidism, and that's the clinical picture, clinical presentation of hypercalcemia. Okay, and there is a mnemonic for it, and I guess that most of you know it, which is bones, stones, groans, and psychiatric moans. I think I have a picture on the next slide that will show it. But in a clinic, since you have a high calcium, so first of all, you are expected you will see a kidney stones because the calcium is high in the blood. Since the calcium is high in the blood, it will be high also in the urine, and the calcium stones will form in the pelvis of the kidney and will descend to the urine. It will descend to the ureter. It may stuck in the start of the ureter, middle of it, or even downstream next to the urinary bladder. Okay. And bones, since the primary mechanism of the parathyroid hormone is to break down the bones, so expect to see like a bone pain, osteoporosis, etc. Okay. Abdomen, for the same concept, because high calcium could lead to a muscle spasm, as also the opposite symptom, which is hypocalcemia, can also lead to can lead to abdomen spasm. Also, hypercalcemia can lead to abdominal spasm. Okay. Chondrocalcinosis, that is more way. That's an advanced stage, and seen mostly in a chronic hypercalcemia. Chondrocalcinosis means that the calcium starts to deposit in joints and in places which is there is a meeting between the joint and the bones, and this is as I said, that's an advanced stage seen mostly in malignancies, which is there's a high calcium. Okay. And the last one also, that is an advanced stage of hypercalcemia, corneal calcification. You see a calcification in the cornea of the eye, and in this case, it needs of course, ophthalmological referral and consultation, because the patient may lose their vision. Okay. So as I said, that's the mnemonic that most of us know. There's the stones, bones, groans, thrones, and psychiatric overtones. Always build up the huge picture, and knows the physiology, knows where the parathyroid hormone works. So whenever you see the case, or you see the question in the exam, you know that they are pointing you to hypercalcemia. Okay. About the other side, which is hypoparathyroidism and a decrease in calcium, you will see there's a common symptom, and there is one which is unique for the hypoparathyroidism. But I think the most important symptom is paresthesia. So the patient will complain of tingling or electric-like sensation all over the body. They will feel like someone is kind of like squeezed them in their hands, etc., or finger, and this is actually so much discomfort, and the patient will complain a lot from this symptom. Okay, maybe this is the only symptom that the patient have with hypocalcemia, especially if it's not that much low. Muscle cramps and spasm, I already mentioned this. The same in the hypercalcemia, we'll see it also in hypocalcemia. Fatigue and weakness, this is also another symptom. Whenever I see fatigue and weakness with patients who have the picture of hypocalcemia, I will also check magnesium, okay? Because magnesium is related so much to the weakness and fatigue. And if you have a low magnesium, severe hypomagnesemia, this will lead to a hypocalcemia, okay? Because it decreased the parathyroid hormone secretion. So take care of this. Brain fog, of course, if you have a low calcium, you will see symptoms of confusion, etc. And even in some situations, you will see seizure if it's severe hypocalcemia. And dry skin or brittle nails, not so much. That's mostly seen in chronic low calcium. But what I think, sorry, what happened? What I think the most important symptoms that you should always keep in your mind are the paresthesia and muscle cramps and spasm. They are the most common symptoms seen with hypoparathyroidism. Seizures, not so much seen in severe hypocalcemia if it's less than 7, okay? There's another scheme for muscle cramps and spasm. Brain fog, already mentioned this. You can check it again. And this is the reference. Thank you so much for watching.